Welcome to the Western North Carolina School of Massage. My name is Dr. John Morgan, and today we're going to be learning neuromuscular therapy to the trapezius muscle, in particular the upper trapezius. The upper trapezius is located at the external occipital protuberance, runs down and across the body, attaches to the lateral third of the clavicle, to the acromion process, to the spine of the scapula, and along the spinous processes of C7 all the way down to T12. We would begin with some myofascial stretching of this area to help affect the epifascial tissue. This can be held for about a minute. And I'll move on for time constraints, and then we'll begin doing pincer compression to the upper fibers, starting at the first head or belly of trapezius, rolling our fingers off the spinous processes and picking up the muscle on the side. And if you're not sure where it is, you can ask your partner to raise their head, and there it contracts. Okay, thank you. So right here we have the muscle, there's the muscle, and then just skin. See us roll off the muscle. So we want to pick up the muscle and just compress it with pincer compression. Pincer compression should be held for at least 10 to 12 seconds, and that allows the tissues to respond to your touch. Or even better, we can use trigger point pressure release communication. And we would go to mild discomfort. Are we at mild discomfort? Mm-hmm. Yes? Okay, so we'll stay at mild discomfort, and will you let us know when that feels better?
Feels better.
Okay, so that was rather quick, so it feels better. So that was one release. And they would come out, move to a second position, compress to mild discomfort, and then wait for the release. And that would be the first head of trapezius. Then we would come around and treat same side, this area, but for the camera we'll stand and continue treating cross body. This is the second head of trapezius. The upper trapezius is the most common culprit of tension in the body. When someone has stress or any type of external stimuli that manifest in the tissues, this is the first place it manifests. So come in here, and again, pincer compression to the muscle to mild discomfort only. Let's know over there. Okay. And will you let us know when it feels better? Trigger points in this muscle. Okay, it feels better. And once it feels better, we can then do some linear fiber friction, further coaxing the muscle apart. And this is linear fiber friction. The muscle fibers are run in this line, and so we want to friction those fibers in the direction they run. The distal fibers of the second head or trap can harbor latent trigger points, which means they're not symptomatic until you activate them with touch. Trigger points in the second head of trapezius commonly refer to the posterolateral neck, behind the ear, and around to the temple region. And a symptom could be a temporal headache. So we want to come all the way out to the distal fibers and pincer compression. That mild discomfort. Okay, just let us know it feels better. Even though we're treating just with one hand at the moment, we want to keep the other hand on the body for a compassionate, nurturing touch.
Feels better.
Okay. And then once it feels better, we can do some linear fiber friction and then go back and start to, as the muscle softens, start to uncurl these fibers, because the fibers roll around to attach to the lateral third of the clavicle. So rather than just compressing them like this, which we do initially, as they soften, we want to come in and start to uncurl these fibers and work the distal edges to thoroughly treat. So we're just going to uncurl those distal fibers. Is that mild discomfort? You would like a little less?
Yeah, that's fine.
Okay.
That's better though.
Alright, good. And then just a little linear fiber friction. We can also work from C7 down to T12, the attachment region, with simple lamina groove compression and friction, just to treat the attachment sites thoroughly. Here, and a little compression and a little friction along the spine of the scapula, working the tendons as they attach to their bony landmarks. This muscle can get overloaded from sustained elevation of the scapula from a pocketbook, a heavy book bag, or talking on the phone supported by your shoulder and ear. Also, it can get overloaded from sustained compression by a heavy pocketbook, a heavy bra, a small thin bra strap with large heavy breasts compressing here. It can also be due to the middle and lower fibers from poor posture being overstretched. In this case, the middle and lower fibers are being overstretched, and rather than treat them directly, we want to and just treat symptoms, we would want to go to the antagonistic muscles, the protractors of the scapula and the medial rotators of the humerus, mostly the pec major, and treat the pec major to alleviate the overstretched, painful middle and lower fibers of trapezius.